Good evening, ma'am.
I am all ready.
Yes, ma'am. How are you?
Better. I had some bad URI. Now I'm better.
Yeah, voice is still sounding hoarse.
Yeah, voice is hoarse.
Yeah.
Hi, Piali.
Hi, ma'am. How are you? Piali here.
Hi. So all ready for a few? शैलजा
Yeah.
नहीं आई.
थोड़ा डर डर के कर रहे हैं मैम, फर्स्ट टाइम है
अरे
ना.
तू क्या डर डर कर करेगी? You are an expert.
वो बोल दिया ना, सबका टेस्टिंग हो रहा है, मास्टर ट्रेनर्स बनाए तो उनका टेस्टिंग हो रहा है. मैंने बोला अच्छा ठीक.
टेस्टिंग नहीं, उनको अपॉर्चुनिटी दी जा रही है. नॉट टेस्टिंग.
हाउ आर यू डूइंग मैम?
हाँ, fine.
आप
I had
अच्छे
a,
हो?
I had a URI, so my voice is hoarse.
आह,
पूना में एपिडेमिक चल रहा है. URI, cough, cold, fever.
ओह अच्छा
मेरी
अच्छा.
दोनों maids are sick, so I also caught it last week. 2 days I was
और
really bad. It was like
फीवर भी
explosive
है?
sneezing. Huh?
यू हैव फीवर टू?
I had fever. First time मैं बहुत दिन के बाद fever आया. 48 hours it was really bad. I couldn't sleep one night with alternate nose block and sneezing.
गुड
So it
गॉड.
was very bad.
डिड यू हैव टू हैव एंटीबायोटिक्स?
नहीं, लिया नहीं मैंने.
नहीं, जनरली
First 3 days I
एंटीहिस्टामिनिक्स
don't
से
take.
हो गया.
3 days I don't take antibiotics. उसके बाद we have to practice rational antibiotic on yourself also.
That's okay, ma'am, but you are a little high risk side में ना, तो इसलिए that is why I was asking.
नहीं, the fever was only in 100 और it was for 48 hours only. अगर ज्यादा रहता तो
अच्छा, then
risk of
it's okay.
pneumonia, no? So then I would have started.
इसीलिए मैम, इसीलिए.
गुड इवनिंग.
Hi.
मेरा मॉडरेटर आ गया मैम.
हाँ.
डॉक्टर संदीप इज हियर.
It was raining and lot.
आई टोल्ड मैडम मैं फ्राइटेंड होके कर रही हूँ बिकॉज मेरे को बोला गया है टेस्टिंग ऑफ मास्टर ट्रेनर हो रहा है.
So Sandeep, I just told her this is giving opportunity to master trainer, not testing.
मैम आप ऐसे बोलेंगे हमारा क्या होगा फिर?
आप लोग यू पीपल ना, मतलब बढ़ता हुआ राइजिंग सितारा है ना. सो मोर ऑफ इट इज एक्सपेक्टेड फ्रॉम यू देन एनीथिंग एल्स.
प्रेशर बढ़ा रहे उनका.
We need more grace. Actually, ma'am.
नहीं नहीं, ये लोग स्टार्स हैं भाई.
Yes, definitely, ma'am.
You're a mentor. These are stars.
थैंक यू मैम, आपने हौसला अफजाई कर दिया.
अभी तेरी लेवल ऊपर है, मेंटोर की लेवल है. एस्टैब्लिश्ड स्टार इज अ मेंटोर.
ये सुनने में भी बहुत अच्छा लग रहा है. Whatever it is. मैम तो पियाली मैम इज अ मेंटर, लेकिन हमको स्टार बना दिया, वो सुनने में बहुत अच्छा लग रहा है.
All of you are doing very well. We are hearing your various programs. We are very proud of all your youngsters.
Your blessings, ma'am.
अमोक तो इज मल्टी टैलेंटेड मैम. एंड
Yeah.
नीतू को मैंने इस बार फर्स्ट टाइम मैंने उसको वहां पे सुना जब पुणे में, मेरे को लगा कितना अच्छा है ये लड़की.
अरे
सो
first
गुड.
time she presented a paper in WPF, she got a gold medal research.
ओ वाओ.
मैम्स
अमोक का तो
गाइडेंस.
मुझे पता था.
क्या?
सब मैम
अमुक
का
का?
गाइडेंस है.
You can polish a diamond, you can't make a diamond.
थैंक यू सो मच.
मैम से नहीं जीत पाओगे मैम. शी इज सो वर्सेटाइल, शी इज टू गुड.
या ट्रू.
No, but I really feel happy when my students do so well. ना बहुत अच्छा लगता है.
Mane ma'am is having some problem in connecting. She is trying
अच्छा,
some issue
okay.
with this.
इंटरनेट. आज बारिश हो गई थी ना काफी पूना
Yes,
में.
yes. There is an issue. We'll take the conflict with parents case first, then peer pressure later. So that
Okay.
will change.
हाँ, if
That
there's
will-
an issue then she can join a little later also, कोई इश्यू नहीं
Yes,
है.
yes. हाँ.
और
We'll
दूसरी
just
चीज में
change the sequence of the cases.
ask her to join through the phone if the computer is not connecting. That is sometimes a little better.
That is what she's trying, but some hold up is there.
Normally she
Sandeep,
joins through a mobile
Sandeep, stop
only.
your screen.
Okay.
आ गया समीर शाह भी आ गया। समीर भाई, गुड इवनिंग।
गुड इवनिंग मैडम, गुड इवनिंग।
मैम,
Good
ये
evening.
सबसे ज्यादा डराते हैं, धमकाते हैं, रादर डराते भी नहीं,
He's our
धमकाते हैं।
headmaster. He's our headmaster keeping
हाँ,
discipline and time.
करेक्ट। हाँ, बिल्कुल बिल्कुल संटी लेके बैठते हैं। He sits
हम
with the
डॉक्टर जैन थे
rod.
वैसे हमारे when we were in AHA, Dr. Jain used to call him घंटे वाला बाबा. He would stop any senior, anybody 2 minutes before the thing. Sir, time up. He didn't bother कौन बोल रहा है क्या बोल रहा है. हमारा पहला जो इटपा हुआ था, everybody had 10 minutes, 20 minute session. तो डॉक्टर जैन की जब घंटी बजती, they had to stop because he was a senior person. और वो बोल देते थे time over, next person.
That is quite crude, ma'am.
नहीं, बिकॉज वो दिल्ली के थे ना लोग, दिल्ली को तो सीनियर लोगों को आदत है, प्रोफेसर होगा तो बोलते जाना बोलते जाना.
वो
तो
माइक पकड़ने से फिर नहीं
हाँ, तो
छोड़ेंगे।
ही हैड टू मैनेज दिल्ली प्रोफेसर्स, तो वही करना था. वो
नहीं,
मेरा
समीर
पहला
भाई ने बहुत
एमडी था
डांटा।
गुड
दिल्ली
इवनिंग
में.
मैडम, गुड इवनिंग ऑल।
शैलजा,
Yeah,
सो
आ
गुड।
गई.
मैंने भी मजा
मैडम मैंने प्यार से बोला था, आटा कहाँ है?
आंटी माझं होतच
हम लोग वी आर जोकिंग अबाउट इट, डोंट टेक इट टू हार्ट। हमें भी पता है समीर भाई कैसे बोलते हैं।
क्योंकि मेरे पास तो सबका बेसिक डिटेल्स होता है, तो हमको आग आप नहीं दोगे तो हमको कहीं से तो निकालना पड़ेगा ना।
और you always need one person who will do the time management and act strict, otherwise होता नहीं है.
सही
That
है।
person has to be in charge and he has to take care. So Sameer is doing that job very well.
हाँ मैम, वी हैड अ ईस्ट जोन पेडिकॉन इन कोलकाता लॉन्ग बैक, आई थिंक 2 years बैक।
हाँ
वहां पे ये शांता लोगों ने मैनेज किया था, शिल्पी, शांता, ऑल दीज
हाँ
पीपल।
हाँ.
दीज यंगस्टर्स दे स्टॉप्ड एवरीबॉडी, बोले हम ब्लैकआउट कर देंगे। एक बार बोला, नहीं सुना, दूसरी बार तो खत्म
But
किस्सा।
see, when you are having an organization and when you have faculty, there is no senior junior. Everybody has to keep to the timing. Then only it works.
आई विश मैम पीपल वुड थिंक लाइक दैट। दे ऑलवेज थिंक हम इतने बड़े हैं, हमको नहीं बोलने दे रहे।
जब मैं एचए में थी तो ऐसा ही होता था 4 साल. अभी आकी में वैसा ही चल रहा है.
नहीं, सुषमा भी वही कर रही है मैम। यू आर 4 minutes लेट बोल के स्टार्ट करती है, मेरे को भी।
हाँ. But see what has happened now. Respecting time is respecting everybody.
ट्रू।
Because it is disrespect to others कि जब 4 पैनलिस्ट होते हैं तुम 15 मिनट खा लो and then the moderator has to tell the other 3 panelists 5 मिनट में निपटाओ. That is not respecting your colleagues, no? अगर तुमको कोई
Can we
टाइम
start?
दिया है, everybody has lot of knowledge. We are not here to show our knowledge. We are here to stick to the time and deliver. That is the art.
Madam,
1
let's
घंटा
start.
बोलना बहुत आसान है, वो 10 मिनट बोलना में requires real expertise.
हाँ जी समीर भाई, स्टार्ट करिए ना।
Can we start?
हाँ,
Yes.
All the faculties are there, so
good.
we can start now. Dr. Selja madam also now stabilized herself, so we can definitely start.
Stabilized.
I'm actually in OPD. This is my OPD time. My patient I have kept waiting outside and I am sitting inside.
जल्दी जल्दी स्टार्ट कर रहे।
So, very good evening to all, and we all are really eagerly waiting for the understanding the life skill, how we can utilize in a systematic way for the our day-to-day problem. Before we start, I hand over the stage to the Dr. Swati Bhava madam to welcome you.
Thank you, Sameer. Thanks, Sandeep, moderator. All our esteemed panelists, Niti, Shailaja, Piali, Amok, kahan gayi? So we had the first session, which was introduction of life skills. And now we are going to the practical aspects and we are doing case-based scenario. And today we have 2 excellent cases of peer pressure and parent conflict. So I will not waste much time in any introduction. I will make my expert comments at the end of each case. So over to you, Sandeep.
Thank you, ma'am.
Presently, I at least introduce the Sandeep first and then we will hand over to him. So, dear friends, very good evening, and it's my great pleasure for this webinar series what we had started specifically to preventive prescription life skill approach for the building the resilience in children and adolescents. The basic concept what we had get after the completion of our 3 batches of the orientation to life skill and followed by our master trainer that everybody has some approach should be there regarding the different problem that is related to the our own adolescent and how we can go for the actually implementation of the life skill, and that is our main aim and objective. Actually identify the problem, recognizing the which life skills are deficient, understanding the different role of the each and every stakeholders, and applying the practical life skill solution, at the same time building the resilience and emotional well-being in the adolescent, and ultimately strengthen the communication and relationship, and create a supportive home, school, and community environment with the help of our head, heart, and hand life skills. That what we had already discussed in our first episode, what they are and how we can actually implement with the excellent story of our growth. Our main discussion that is related with the case-based discussion, and now onward after the every 15 days of the 16 minutes, our lead moderator will give the discussion mainly related to identify the problem, which life skill is missing, what is the understanding of the role of that stakeholders, and applying a basic solution. We are not at all focusing into the any psychotherapy or detailed psychiatric management or clinical treatment protocols. And for that, today we having one of the eminent our master trainer, that Dr. Sandeep Kavre. He is from the Pune, Maharashtra, practicing pediatrician and child and adolescent consultant at the director at Vatsalya Mother Child Care Grocery, and director of the Manumai Child Development Center. He is the author of the Coping with Stress in the Adolescent and Common Questionnaires format in the history taking in chapter of that adolescent textbook. With this short, very short, ultra short, we can say introduction of the Sandeep Kavre, I hand over the total stage to him to introduce his faculty and continue the further proceeding. Over to you, sir.
Thank you, Samir Shah sir, for this wonderful opportunity. I'll just share my screen. Mhm. Is my screen visible?
Yes, visible.
Thank you. So, as we said, this is not a case-to-case discussion like we do in our PG classes or we do uh, for a health assessment in adolescent practice. What we are focusing on is application of life skill and how it can benefit. And we have a panel of stalwarts for the first session, starting with Dr. Piali Bhattacharya ma'am. She is a professor of pediatrics at Sardar Patel Institute in Lucknow, Uttar Pradesh, and chairperson elect at AHA in 2026. She has received various awards and one of the stalwarts in adolescent medicine in India right now. Followed by we have Dr. Shailaja Mane, ma'am. She is my teacher mentor from HOD from DY Patil Medical College in Pimpri, Pune. And she has lots of achievements across fields, right from human milk banking to adolescent medicine, and has received numerous awards in this field. So she will be our second guide for the case scenarios. Our third stalwart is Dr. Niti Soni, ma'am. She is a practicing pediatrician and adolescent expert from Chhatrapati Sambhaji Nagar, where she runs her own Sony Hospital. She's director, and she has contributed at various capacities as author, as speakers, as researchers in various publications. Then we have Dr. Amok Shahane, ma'am. She's also a pediatrician, adolescent health expert, and as ma'am rightly described, one of the upcoming stars from AHA, which various contributions as in IAP, AHA as secretary, treasurer, and having different awards for her contributions in the field of adolescent medicine. So we have experts across the domain of adolescents, and we'll be focusing on two cases scenarios today. So starting with the first case, I'll give you the brief approach and we'll then ask the questions. All experts are and fact delegates, if you have any questions, this is a panel discussion. Your questions are always welcome. Kindly put them in the chat box. Our stalwart of the panel will answer, and even Swati Bhave ma'am is over here. She will also contribute to the discussion in the end to make how we can best apply skills in actual case scenarios we come across in day-to-day life. So this is Aryan. So Aryan is a 15-year-old studying in CBSE school. His mother is an IT professional, father is a corporate executive, has to. Aryan is very competitive. But what has happened is, since last few months, his academic performance is going down. He's online till 2 a.m. Sometimes mother is there, sometimes nobody is there to monitor him. And he's become irritable and secretive. He wants now branded things. He's avoiding tuition and sometimes even lied about it. And parents have come to you because they found something, some electronic device in his drawer. This child doesn't have any clinical history of any medical illness. The child and parent work frequently away. The parents sometimes have to stay. And they have just shifted to a new school. And here the circle is very competitive. And Aryan wants to fit in. When he do a short head assessment, we see that the parents are very caring for him, but they are too busy. Mother has to work from home. She has a very uh, busy job, and father has to travel. His education, his grades are falling. Activities, he likes to go to with his new peers to weekend outings to malls, and is very, very involved in gaming. He says that his friends are vaping, but he denies, I don't do such a thing. He has interest in building romantic relationship, but is not in any relationship at present. Otherwise, he is very good for there is no uh, mental health issues like suicidality or depression which you assess. And safety wise, online there are certain risky challenges, but otherwise he's not going for any other kind of behavior. Risk factors include fear of exclusion. So he's very worried that my friends won't accept me, and he wants to fit in the new group. He wants validation from his peer, so he does challenges which they give him. So on social media also he thinks of going to groups. Now the exams are coming, so pressure of academics is increasing, and because of his performance drop, even the parents are worried, and he is also getting anxious. Parents want to help him, but they have their own hectic schedules and cannot always monitor him continuously. What we see is his mother has a very good rapport with him, and even though there are certain conflicts, he has trust in her and shares his feelings with her. What we also see that Aryan is very good in cricket. He has very interest in has lots of interest in the sport, and also has a good circle in his sports team. And even his sports teacher is very helpful for to him. And Aryan likes and respects his sir very much. So this is a short history. Now we'll go to our experts. So I'll start with Piali ma'am first. Ma'am, we see that Aryan has just shifted to school and is in the new peer group. So everybody, when they are going to a new place, want to go and fit in over there. At the same time, there is certain changes in his behavior. Now, using life skills, how can he differentiate that this child is has a normal desire to fit in, or some peer pressure is occurring? How can Aryan himself understand when that line is crossed? So, can you please elaborate on the life skills which he can use?
Thank you so much, Sandeep. So, first, when we do a risk assessment in this child, we find there's abrupt personality changes after joining this peer group, this new school. There is increased secrecy. He's hiding something in his bag. There is declining academic performance, and possibly there is some risky experimentation and an inability to identify personal values because he only wants to fit in. There is also dependence on peer approval, and there is repeated cognitive distortions. If you ask him, he will say, no, 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 the vaping device is all right. Everyone does it. So if this kind of a statement comes from Aryan, that everyone is doing it, sometimes this is not evidence of poor skills. The key question here is whether Aryan can evaluate or differentiate peer influence independently, or he simply confirms without any reflection. So a useful way to assess the quality of his reasoning, not merely his behavior, would be thinking about the WHO life skills. So the first skill which seems to be lacking over here is creative thinking. Like if he says everybody is doing it, then we need to challenge that assumption. Like, who is everyone? What do you think? So the next thing would be self-awareness. So the behavior is for peer approval. He is not analyzing or trying to find information. And definitely, he does not understand own self-worth. He only looks for peer approval. The third would be decision making. He has abruptly changed his behavior once he has come to this group, and he is not able to do anything about it. And of course, assertive communication is missing, because if he is into any risky behavior, he does not know how to cope with peer pressure and say no. The last but not the least is problem solving. Since he's not understanding any of these paths, he is unable to explore any alternative way to gain acceptance. I mean, simply having this vaping or doing this would not mean that he is fitting into the peers, but there could be other alternatives. He's good at cricket, so maybe he could take up a cricket match with these people and that way become a fit in with these peers of his. So all these critical thinking, self-awareness, decision-making, assertive communication, coping with peer pressure, and problem solving are lacking in Aryan.
Very well said, ma'am. So, even in the case where we discuss health assessment, we can clearly identify life skills which are lacking. And as ma'am said, the self-awareness Aryan does not have, when that pressure or desire to belong to the group has converted into a pressure he's taking away him from things which he values and things which are important to him. So now I would like to ask Shailaja Mane ma'am. Ma'am, are,
ये लिंक करना है भाई, टंग आ गई तो पढ़ते पढ़ते
kindly mute yourself other than the speakers. You can post your questions in the chat box. Thank you. So I would like to ask Shailaja Mane ma'am that Aryan is demanding. Now we think he wants to go to the mall. He wants newer things, branded things. He also has been caught with lying about tuition. He is not able to say no to his peers. So how can we help him? One, focus on his things which is important to him, like say, because this is strength, and how he can avoid this conflict and lying and other things by communicating with his parents. So what can be done for this scenario, ma'am?
Yes.
So Mane ma'am.
Thank you, Sandeep. Good evening, all. Thanks a lot, respected Dr. Swati Bhave Madam and entire team of AKI for this much needed initiative. So coming back to our case, Aryan is lying. So we have to first understand why adolescents lie. So they might be having fear of criticism, punishment, desire to fit in, or desire to have increased independence or even privacy. There might be some peer pressure, and he is in need of social acceptance from the peers, which is normal phenomenon in adolescent age group. It is a part of development. He might be having some low self-esteem also, or some academic pressure, or he might be testing his limits or even boundaries, or he might be protecting his friends also. And there can be sometimes when there is ADHD, there can be impulsivity to lie also. So, and lastly, there can be some anxiety or depression or mental health issues. So persistent and manipulative lying, if it is there, it can be a part of conductive disorders or conductive problems as well. So how parents should respond, we should first see. They should stay calm. They should identify reason why he is lying. They should reinforce honesty. They should have means they should not label. They should avoid labeling. That no loose comments like you are a liar or something like that. And they should try to build the trust, and they should model the honesty. So role modeling should be there. But coming to what are the solutions? So why he might be lying? There are, or adolescent might be lying. These are the reasons commonly. But building effective communication and assertiveness skills are main important things or skills to handle the peer pressure and to reduce the anxiety. So strong communication and assertiveness help adolescent to build the confidence also, and they can resist the peer pressure in a better way or handle the peer pressure in a better way, and they can have develop the meaningful relationship as well. So they can have even FOMO, fear of missing out also, and there are various skills which we should teach. But coming mainly to communication skill, we should teach him to do active listening. So encourage them to maintain the eye contact with the peers and friends, and they should do listen without interrupting, like nodding the head, ha, who they can do, say like this. And they should ask, we should tell them to ask and clarify the questions what they are having or doubts in themselves, and they can reflect back. So this is about active listening, what their peers are saying. Then we should tell them to express themselves or their feelings very clearly. And non-verbal communication should be also in a proper way, in alignment with whatever they are doing, saying verbally, like confident posture, eye-to-eye contact, and their tone should be proper. They should have calm voice, and uh, they should not uh, cross the boundaries of aggressiveness actually, because it can turn into the problem, or they can go into the trouble situation. They should have empathy. That means they should consider the perspectives of the others also. And assertiveness means saying whatever they feel firmly and confidently. If they want to say no, they should be able to say no. So there are various ways how to say no, like cold shoulder, reversing the peer pressure, etc. But they can say simply, no, thanks, I'm not compatible with it. I would rather go away from it, or this is not my cup of tea, like that. So for handling peer pressure, we can have 5 Ds actually. Delay, that means maybe later on, I will see you later on, like that. Or no thanks, they can say, or they can distract or change the subject, and they can leave the situation. They can discuss if they are having some trustful, they should have some, at least one trustworthy adult. So it will be helpful for managing the anxiety related to peers.
Very well said, ma'am. You told about the various reasons adolescent can lie and what we should do to teach, because it is very easy to tell them to do, but unless we show them, it is very difficult
Yeah,
for them
role
to model.
modeling should be proper. Yes.
I
Thank
would
you.
also continue the case with Dr. Piali, ma'am. Ma'am, now he's putting on playing video games late into the night, and he's gone into that dopamine loop where his gaming is giving, and that is affecting clearly his academics also. So, what kind of activities we can do? Because this is quite common across board where teenagers are involved in gaming, late night gaming season. So, what should they be told them so that they can get themselves away from such habits? So, what would you suggest to an adolescent like this?
See, Dr. Sandeep, for a 15-year-old, the goal should not be simply restricting the digital technology. Like, you cannot snatch the mobile from his hand or remove the screens totally. But what we need is to strengthen the life skills that allow him to, number one is pause, think, and then choose. So the pause is very, very important. So teaching Aryan to pause before responding to any challenge or any impulse. Basically, what we are doing is we are shifting from impulsive thinking to reflective thinking. The pause is very important. What am I feeling right now is one question he should make to himself. Then he should actually answer that, and then he should think about what happens in the next 10 minutes. Lastly, he will then choose Does this make me closer or further from the person I want to become? So this pause, as I would say, is very, very important. So in addition to his critical thinking, as I had said earlier, self-awareness, decision making, problem solving, all these things, he also needs to understand coping with emotions, coping with stress, and as Shailaja has said, assertive communication. Now, number two, after this pause, think and choose, number two thing that we would ask him to do was, is a digital dopamine diary or for self-awareness. Say about a week's time, he's keeping a diary on what triggers it. Was it boredom which is allowing him to do this? Is it loneliness? Or are the notifications actually catching up? What is actually happening and triggering this kind of a digital dependence? Then what is the activity that he is choosing? Is it gaming? Is it scrolling? Is it some kind of a challenge like we had that blue whale challenge and all those things? And then what is his mood afterwards, before and after, and about an hour later? And what is his sleep pattern? Often what helps, this helps in the adolescent in sort of assessing himself. When you write it down, then you can assess what is happening in between, and it helps him to distinguish also whether this is a temporary excitement which is helping him, and what is happening later on itself. Not only that, there is a reality check with these people. And the traffic light method again, teaching Aryan to classify. That means what is his online activity? Green means the homework, the assignments from school, things of that kind, or some hobby, or he's learning music on it. And then yellow light. What is the yellow light? Casual gaming, social media, and finally the traffic light red. That is, you are sharing personal information. Is there some cyber bullying, or is it a dangerous online game? All of you have heard about the Noida sisters committing suicide. So sometimes these games will take you down and actually dare you to do some high risk activity. And last and if not the least, he should be learning refusal skills. He has to see and say, as Shailaja was saying, no thanks, or this is not worth the risk. But we must also remember that in helping parents, we also must talk, in helping Aryan, we also must talk to the parents also. So role modeling again, and the communication, since with the mother is good, maybe that is a very strong point for him. So the mother can speak to him about her concerns and find out what is actually guiding him into all this. And then only once the communication line flows, we will be able to help Aryan go ahead with the changes that we want.
Very nicely put. So we already moved on to the parents part. So I would like to continue on the same with Shailaja Mane ma'am. The parents are also feeling guilty because mother cannot give the time, father has to travel. But that is
Yes.
the fact of the society today, and this is
Yeah.
what happens. So
Nuclear families.
what skills we can give parents so that they can help the adolescents? Because the desire is there, but many times instead of helping, they are aggravating the problems. So what life skills do they need?
Yeah. Actually, parents need counseling about they should give this quality time, and quality cannot be there without quantity, of course. So parents need various life skills, and they are also having their own stresses, like hormonal dance is happening in the home, menopause, andropause, elderly health issues and all. But still many parents feel that their main thing, what is financial support and all, they are giving to their children, and that is just enough. But that is not enough. They really need connected, and they need they are also having demanding careers as of like adolescents, but they need parent adolescent interactions, and they should have common reasons to do that, like looking for working hours together, or they can have uh, time, when parents are not giving time, adolescent can perceive that their parents are not interested in them, and this is the main crux for the, or main reason for the problem. So they can use screen, like in this adolescent they can have risk taking behavior, which is again here, and emotional distress also. So we should build them their skills, like we should tell them that they should monitor, but they should mentor also. They should instruct to some extent, but they should do active listening also. Instead of controlling, they should have collaborating efforts to do with the adolescents. And instead of reacting, they should try to connect. So they should find out the total time, which can have family time, and they can go for trekking, hiking. They should have interpersonal relationship skills, and they should try to understand what adolescent needs, and they should first do active listening without any interruption, and they should give full attention whenever they decide that we have to speak, or they can have some 15-20 minutes at least regularly. Regularly giving attention and regularly giving family time is very important. Consistency should be there, and they should have uh, the skill to validate the emotions, what that adolescent is feeling. हमारे जमाने में नहीं था, हम लोगों ने भी ऐसे किया था, वैसे किया था. Comparison should not be there with us also and with their peers also. And they should practice empathetic listening without interrupting, empathize the feelings, and try to acknowledge the perspectives of the adolescents and reflect back. I understand how you must be feeling like that. And we should try to navigate through the problem, or navigate towards the solution together. So feelings and opinions of adolescents should be taken into consideration. So we should create daily emotional rituals, like emotional, what we can say, schedule also, like establish predictable moments of connection, like after dinner they can go for a walk. There should not be any screen. It is said that family which eats together stays together. So without screen, there should not be any stressful discussion of marks, career, or something like that. So we can discuss lighter moments. What was the hardest part of your day today? We can start discussing like from our perspective. कि मेरा आज दिन ऐसे गया वैसे गया, and they can see movie together on Saturdays, Sundays. They can read, go for hiking, trekking, and reduce the digital distractions during that. And another thing is we should empathize. We should strengthen the empathy skill also, and encourage the collaborative efforts for problem solving. So building the interpersonal relationship skills among the parents also is very important. They should show positive efforts from adolescent side also, or each other's also, and they should appreciate that efforts. If mistakes are done by anybody, they should apologize, or that adolescent should, sorry, please, thank you. These are the three magic words actually. And they should respect the privacy of the adolescent and avoid
Great.
sarcastic comments. And celebrate the efforts rather than perfection, and express the affection through words, action. जादू की जप्पी भी दे सकते हैं, and we can put the hand on their shoulder, head. So touch is also very important part of parentism, particularly in such situations when adolescents are also in distress. Thank you.
Ma'am, both of you are doing a great job. There is a lot of discussion in the chat also, which we are getting feedback. So,
Okay.
before we wrap the case, I would like to ask one question each to both of you. First, Piali ma'am, even we got a question in chat. The vaping, when such an incident happens, parents are panicked. All this logic goes out of the window, and they need to take certain action, and they get aggressive because that our natural tendency. The worry creates problem. Similarly, there is a case which delegate has asked, that there is a case where the child was found with drugs. Now they have sought a psychiatrist, and the drug problem is brought under control. But whether to give the device mobile, right now, child Aryan in this case was having online gaming addiction. Do we trust and give the device? Because again, that could be an access to further drugs or further gaming or even vaping for in case of Aryan. So what should be the parents' way, and how should they handle such a crisis? Really, ma'am.
Okay. So if that be so, then we have to see what we can regulate and what we cannot regulate. So, first is that this decision is always a stress coping thing. So we have to ask Aryan to move away from vaping by giving him alternatives. So alternatives would be, maybe if he has the feeling to vape, maybe he leaves the device at home, goes for a long walk, or does a deep breathing, or any kind of sport like cricket, or some short break with his parents. Now, the parental approach also should move. The parental approach should move from what are you doing? Why are you doing? I will restrict this. I will restrict that. To we are concerned. We care. We want to help. And we are concerned. So what is happening is over here that the parents may also be involved in scrolling, in gaming, or in mobile, and to maybe too busy. Like Shailaja said, some time is required, maybe quality time for the child. So the child is not getting quality time, and therefore this is happening. So the approach of the parent should be absolutely what I call calm approach. See, for control your own emotions, instead of beating up the child, instead of snatching devices from him, you need to control your own emotions first. As I said, pause, think, and then choose about what you want to say. So do avoid confrontations, move away while everybody calms down, and then talk to the child. Next, the questions that you ask to the child should not be interrogative questions, Why did you do this? Why did you do that? You pointing fingers always shuts the door to communication. So ask open-ended questions like, Beta, we found this device and we don't know about this device. Can you please tell us something about this device? We would like to learn what it is used for. So you should help me understand. Then comes L. Listen without interrupting. The child may not want to talk at that moment. Choose some other moment to talk to him. Do not put him in the kadghada, like you are putting him in an interrogation cell and you are actually repeatedly asking. So the child will clam up. He will absolutely not say. But give him some time to give his feedback. Listen to him without any interrogation. And then this is very, very important. M means C for control your emotions, A for ask open-ended questions, L for listen without interrupting, and M is the most important part. You must plan together. It should be collaborative. You cannot take unilateral decisions if it is not risking his life or life-threatening issue. So with this, you have to sit with the adolescent. You have to ask him what are the goods and what are the bads. So it is like a tarazu, it's like weighing the scales. Like when I was trying to choose my career, my father put his hands up like this and he said, if you take surgery, which you want to take, this is going to happen and this is going to happen. If you take pediatrics, which I want you to take, you have these many miles to go. So obviously there is a non-verbal communication which is going on. There is an option which he is placing before him. He is telling me the ins and outs of each professional career. Similarly, with this device, you can tell him all the goods and the bads. And ultimately, if the parent thinks he needs counseling with an expert, he can come to any one of us or he can take to the psychiatrist or psychologist as well. So basically, the parents need to regulate before responding, before shouting, before snatching, before interrogating. Then they have to basically separate their observation from immediately interpreting what is happening. Then it should not be a cross-examination, like I said. And the last is problem-solving approach, which should be a collaborative approach. The adolescent has to have his own rule book made by him so that he follows all that. Otherwise, what will happen is he will not follow whatever it is. And each time, if he does not follow, you can always give him a reminder that, Beta, you said that you would do. I am concerned because you are not following that rule which we made together. So that way maybe we can. But
Yes.
if really we are suspecting substance abuse, it would be better to go to an expert instead of trying to deal with it yourself.
Sandeep,
Very
can I
well
add?
said, ma'am. Yes, ma'am.
Yeah, actually, Piali had very nicely elaborated, and we can give him a positive way out of it. That we can give other option, which is sports. He is good in cricket. His coach is
Correct.
also
I said that.
supportive. So, academic achievements are getting greatest attention actually in our community. But non-academic protective factors like sports, physical activity, they play actually critical role in promoting mental health, building resilience, healthy identity formation, and endorphin, happy hormones release, and so many emotional and psychological benefits are there. Thank you.
I mentioned that. Yes.
Yes,
Sports,
ma'am. Correct.
hobbies, reading, walking, breaking from the routine.
So, ma'am, so don't judge, connect before correction. So that would be great. So that would be summing up. Very well said, ma'am. So last, while wrapping up this case, Shailaja ma'am, last small question. As a adolescent expert, what creative thinking tools can we give the parents and the adolescent so that there is some action towards changing the situation? What would you suggest?
Yeah, actually, we should try to build the bridge between adolescents and parents as a pediatrician or adolescent health physician. Like, for example, we can give them advice to have family media behavior or behavioral contract, what we can say. We should provide them the guidance, safety, and how to utilize the negotiation skills of parents to come on the same platform. And we can take active participation uh, with adolescents and parents. So we can help them, for example, family contract. Actually, it works. Why? Because it fosters the mutual respect and trust. And both adolescents and parents both have to follow the rules and create one collaborative framework. And it reduces the power struggle. Adolescent also feels that, yeah, we are on the same platform. And it encourages the responsibility and accountability on the adolescent adolescent part also. So it promotes open communication and it supports the healthy independence, which is the ultimate aim of parenting for the children. And it creates the predictable expectations that what can happen. And it usually shifts the parent adolescent relationship from control to partnership with the adolescents. So for effective family contract, we can collaborate with the adolescents and we can tell them to literally write together what they are discussing and what they are coming into the final words actually. There should be specific clear cut expectation. We can say SMART goals. It is the mnemonic. And there should be consistency and it should be applied fairly. If no mobile after 10 or before bed or only 2 hours, it should be rules and regulations should be same for all the family members, other siblings and even parents. And we should acknowledge smaller efforts of corrections and we should encourage them and reward positive behavior in various ways. And we should not only scold for mistakes actually. So we can
Okay.
have shared decision making and we can tell them about the healthy boundaries which are for all, not only for adolescents, and everyone should be accountable for that. And every 1 or 3 monthly, depending upon the situation, in this case maybe 1 monthly, we can review, we can tell them to review the agreement. And we should encourage about the family and media contract as well, media free zones and family time, no media during while taking the food and uh, other uh, means think before posting, like that.
Mm.
Digital footprints are not cannot be erased. Media literacy should be encouraged, and family behavior contract should be there. And ultimately, at last, parents should behave as a role model.
Very well said, ma'am.
Sandeep, can I add on?
Last bit, ma'am, because you have to
Can I
move to the
add
next
on,
session.
Sandeep?
Yes, ma'am. Last 1 minute.
So the thing is that when the parents talk, they unintentionally, they hurt the child's self-worth. How many marks did you get? That is how they ask once the child comes home. Instead of that, the communication should be a little different. So, like, what were the challenges? Did you, once you see him coming crestfallen, muh latka hua, or slamming the gate, he's angry with himself, he has some guilt and shame. So, that way, then that, as Shailaja said, the Jadoo Ki Jhappi helps. But then, what challenges did you face? or how are you managing this stress? Let us sit together. So that togetherness, that collaboration actually always helps. And not only the parents, the school also has a role to play in it, because the atmosphere today in schools is very, very competitive. In coaching centers, it is very, very competitive. So schools also have to play, because they have to teach certain things in class like awareness. They should not be stressful. Study should not be stressful. It should be an enjoyable thing. So providing skill sessions before the examinations, then offering some support, peer support in mentoring, or making counseling accessible without a stigma. "अरे, ये तो पागल है, counselor से मिलने जाता है." That should not be there. A healthy atmosphere should be there at schools. All these will also reinforce the child's self-worth.
Thank you both, Piali ma'am and Shailajamani ma'am. You have beautifully told how we can help Aryan. So I would like to request, sometimes we require our most senior person to also share. So our teacher of teachers, Bhave ma'am, to add so that we can finalize this case. Ma'am, please.
Uh, all the two participants, I mean the panelists, both Shailaja and PLA have done such an excellent job. And if you can see from the chats, even the participants have contributed so nicely. So I won't go into a very, very detailed thing, but just to summarize that all 10 life skills are required in such cases. So let me give an example. Take self-awareness. The parents need to make the guy self-aware. What's his weakness? What is his strengths? His sports, his academics, etc. Only when his self-esteem comes up by the parents, then he will withstand peer pressure. And once he does a SWOT analysis, he will know what is more important. Is my career, my cricket, my academics, or vaping and enjoying with friends just now and coming under peer pressure? So by making him self-aware and increasing self-esteem, the parents will first put him on the understanding of his self. Second, coping with emotions and stress. The parents, as both of us have rightly said, validate his feelings. Coming to a new school is extremely stressful. It is a lot of coping with emotions, fitting with the new group. It is very, very difficult. So validate, yes, you are having difficulty in coping with stress and emotions. And that is why you did vaping. Because vaping is a very relaxation with nicotine. And you have gone through an unhealthy mechanism of coping with your stress. So vaping is a result of your inability to cope up with your stress and emotions and your inability to resist your peer pressure. So it's okay, you have done it once, but let us see how you do not continue on the same path by explaining how vaping is going to be bad for him in long term. So you, as Sandeep said, first you connect and then you correct. So you have to explain that, yes, we understood you vaped. We understood you're going through a coping stress, but now this is the way forward. Then interpersonal relationships and communications, as again both Piali and Shailaja said, they must open the bond with their own child. Because if they have good interpersonal relationship and communication, the child will have more and more openness. And this lying which comes out of defense, out of protecting oneself, will become lesser and lesser. Once he knows that the parents are not going to be judgmental about his mistakes and they're going to help him, he will definitely lie less and less. Then you, as we know, the frontal cortex is not well developed, prefrontal. So thinking skills. So again, they have emphasized that they should teach the child about handling these issues of coping with stress, emotions, peer pressure, fitting in, vaping, video games, addiction, etc., by using his critical thinking and then coming to a problem solving and decision making, and then using a creative thinking to see what are the options. And again, they both have clearly identified that instead of vaping, what can he do? What are the other options will make him happy? And then last but not the least, by in life, there have to be priorities. So if your child is undergoing certain stresses like this, like relocation, peer pressure, vaping, it's time for one of the parent to take a step back for some time. And I don't mean the mother or father, it's not, I'm not gender biased, but whichever parent at that point of time can take a little a back step from his career, because this is the time the child needs their support. And a 1 or 2 months taking a little break from their career and being there for their child. Because this is a child now who's gone into vaping, he's gone into video games, he's gone into peer pressure. So mere just giving him quality time of half an hour, 1 hour, doing a job may not be what is required. And one parent, if he just gives this 2 or 3 months to the child at this critical time, it will go a long way in helping this child come back to the right road. And it also give him think that my parents care so much about me and they're really concerned on the path which I'm going, that they have taken a step back from their career and they're helping me. And if that they're doing to me, I also need to really reflect and think that what path am I going to? And this is the way parents, because when you both are very busy working, how much time can you really give your child? And that much time may not be enough when your child is normal and is not gone into any path. That time is excellent enough. But this child has already gone into a lot of high risk behavior. He's already gone into vaping. He's already in video games. He's already going down the addiction path. We can see that he's not interested in academics just now. We can see he's undergoing peer pressure. So it's like, when somebody's ill, don't we sort of give hospitalization or antibiotic coverage? Think he was a patient who requires therapy. This child requires extra mental support. And as a parent, that extra mental support will have to be given. Only then the child will come to you, to a psychiatrist or a psychologist, because he understands that you are really concerned about it. Thank you.
Thank you very much, ma'am. So let us move to our second case. Just share my screen. So we discussed about Aryan. Now this is another case of Ananya. Ananya is 16, just passed 10th, 11th standard, excellent student. She is preparing for NEET. She has high expectations she wants to do. But what has recently happened is she is having now frequent headaches. She was very interested in dance, but she has quit it because she thinks the exams are coming. So she has to prepare. The family is an urban family, grandmother is at home. Here, the problems, everybody thinks differently. Mother is thinking, वो constantly argue करती है, she is not interested itself. Father is, ये सब problem because of phone. And Ananya is thinking, nobody is listening to me. I am having these severe headaches, what? And I'm not getting any help. When we see heads framework, there are frequent arguments within the family. There is a lot of academic stress, which also because Ananya is a very good student, she is taking stress on herself. Activity she has stopped hobbies. There is no negative drug related history. She has some online friendship, but nothing which can be problematic. She feels lonely, but there is no suicidality at the present. And there is some excessive screen use. There is poor communication within the family system. She is a perfectionist, but all that is creating academic stress and sleep deprivation. What we can see is Ananya is a very insightful child. She has a elder cousin who is a working professional, and she is connected to her very much. And the parents are very interested and helpful to her, but right now the communication has completely broken down. So now let us move on to our first expert, Niti ma'am. What I would ask is, Ananya is having this headaches and everything. She is stopping her hobbies because of it. It is disturbing her studies. How can Ananya be aware whether this is stress related, whether this is a physical pain? How can she be aware of this, and how we can help her identify that?
Okay. First and foremost, I would like to thank Swati Bhave ma'am and the complete team, Sandeep sir, for giving this opportunity. And now, a good evening to all the people who have joined in. So, coming to this case, so Ananya has been having frequent headaches. And second thing is she has stopped dancing, which was the thing which she was interested in. So both these things are signs which show that she is having some sort of emotional stress, and this is affecting her physical health. So the things that what we can how she can assess that this headache is not because of some organic cause inside, but it is because of her stress. So the first and the foremost is self-awareness. So self-awareness is being aware of your own self, your likes, your dislikes, your thoughts, your feelings, your behaviors, your stresses. So just if she does the SWOT analysis, as madam had suggested in the earlier this thing, she'll be knowing that these are her stresses. This is the place where she is falling weak. For example, the academics, her NEET, maybe the expectation from the parents. So, and her own nature of being a perfectionist. So these can be her, like maybe call her weaknesses. And she can know her strengths also. Like she has been a good student all throughout. So she can actually start journaling. And journaling, she can make a journal where she can write down when she was having headaches and what was her mental state at that time, and what was she feeling at that. Just by journaling, she by in itself she'll be able to come to a reason that yes, whenever she was under stress, she was getting headaches. Then second is she can, through
Ma'am,
journaling in itself, she can identify her stresses also. Like what it, sorry, did you say something, Sandeep sir?
your voice was breaking a bit, ma'am.
Okay. So she can, okay.
Yes,
Is it
ma'am.
okay now?
Yes, ma'am.
Is it okay now? Okay. So it will, okay. It will, the journal in itself will guide her to reflect upon what was going. Then the dancing, which was giving her pleasure initially, which was lifting her moods up and which was a stress buster in itself, that she had stopped. That if she regains, if she starts again, definitely it can help. And then by the second thing is coping with emotions. She has been stressed and she's not been talking about it to anyone. There was very poor communication in the family. So if she starts talking openly about it to a trusted parent, maybe a teacher, counselor in the school, then coping with emotions, again, she can take up all those healthy relaxation techniques which are mentioned, such as deep breathing, maybe progressive muscle relaxation, mindfulness. All those things will help. Dancing the hobby which she was having, if she takes it back, the serotonin release will again help. Then she can start going forth with the healthy routines like sleeping at correct time, then taking correct balanced nutrition, taking regular break from studies also, all these things. And then definitely needs to do a positive self-talk. So these are all the different ways in which she can cope her emotion. Doing all these things, I think she'll be in a better position to understand herself also and will be able to cope with her emotions as well.
Very well said. Madam talked about lifestyle correction and about emotional journaling, which will help her to help the control her emotions and cope with them. Now I have to move. Here we see three well-meaning people are trying to help each other, but instead of helping, they are increasing the conflict. Either mother's communication, father's accusations of addiction, and Ananya's feeling that no one is listening to me. And this is very well when we see a patients in our OPD, this complaint or this comment we get commonly from adolescents. So how can, with the help of life skills, improve this situation? I request Amog ma'am to kindly elaborate.
Thank you, Kavde sir and Swati ma'am and all of the team and Aki. I won't repeat the same things, but I'm really honored to be with all of you. So continuing where Niti ma'am left off about self-awareness and coping with emotions. What we've seen over here, like the history has told us, it's a urban family. Both the parents are working, so they must be having their own stresses because of a fast-paced life, and they have their own expectations because now since she's already 16, they have some expectations from her as to how she has to behave responsibly. But then what is being observed is they must be having some communication gaps in their day-to-day life, because of which now Ananya started feeling lonely. She's now more dependent on the screen and she's developed some online friendship also. So the life skills we need to focus over here is effective communication skills. So it starts off with the parents. First of all, like how even Dr. Shailaja ma'am said, we have to practice non-judgmental active listening. Instead of, hitting the child with criticism and blaming, we have to think about how to connect with them before we start correcting them. And that is very important. Second is, as adolescents grow, instead of going for a monologue, they would rather go for a dialogue, because now you cannot preach them, lecture them, and instruct them or tell them to do specific things and order them. So it has to be more from a monologue into a empathetic dialogue. So this helps in, what you can say, decision making, and helps in conflict resolution by respecting her viewpoint as well. And as parents, they can also spend quality time, which we've all been discussing since the past half an hour, 30 minutes of dinner time, where they can have active communication with her. And they should be like without any screens, and they can talk about everything else other than academics, because it's not only about NEET and the performance. And so that she gets, a safe, receptive environment to share her feelings, and they can discuss about significant events in her life other than academics also. So indirectly, what happens with these communication skills, it turns these confrontational exchanges into opportunities for growth, for connection, and for understanding. So basically, we have to work on the communication skills between the parents and Ananya.
Very well said, ma'am. Communication would be the first step where parents can help her. But continuing, we see a perfectionist child who is taking such intense academic pressure that is affecting her psychological well-being. So, what can parents do further to help her so that they can balance this too? Niti ma'am, I would like to you to share how
Uh,
the
so,
parents can.
uh, so here, when we want the parents to help the child, I would want parents and Ananya to do it together. I would like to suggest them to go with some problem solving skills to be developed in Ananya, and in a way they can actually identify the different problems that Ananya is having. Say, for example, we can say that Ananya was not that good in physics and taking a lot of stress of physics. So once the problem is identified that she is having problem with physics, then she can actually divide that problem into smaller part, break it up. So for example, here we can actually suggest in the problem solving, we do first the assessment of the problem, then break the problems into the smaller parts. So here she can actually keep on solving, say, around 30 problems in a 30 MCQs in a day. And we can set a smart criteria. So specific, measurable, achievable, realistic, and time bound things we can suggest Ananya to take up. So say maybe 30 MCQs in a day for physics, which looks realistic, which looks achievable, and in a day. So we have given it a time bound also, and see how she is doing. So we are assessing of the plan that we had taken, that physics में weak है तो ये करके देखते हैं. So here the cooperation of the parents is also needed. They have to be very supportive. They cannot analyze कि this test you have got only this many marks. So no, this isn't working. At least give some time and see whether her performance has increased. The next thing is she needs to be encouraged on following this routine for some time, maybe a month or so, and then assess. Yes, this has worked. So 30 problems were less, maybe now you need to exceed it to 50. So in this way, a collaborative work of the parent and Ananya together will help in coming to some consensus and improving her performance in the exams.
So parents really can help for some children like having perfectionism. Instead of discussing the marks, discussing hobbies would probably help more. Ma'am has very well said how they can help her to timely goals setting, which can be increased. Now we found out this is a multi-generational family. Aki, we are also included, Bhave ma'am, grandparents' role in a family. So, Amog ma'am, I would like to ask you, how can we leverage this strength? Or is it a strength in all situations? And if it is, how can we leverage it?
Yeah, I think Ananya definitely has an advantage since she has a grandmother at home, unlike most of the nuclear families which we see today. Because the presence of grandmother is like an important emotional harbor in her life, because her parents seem to be all the time busy. So grandmothers, because they are having a lot of wisdom, they have a lot of patient hearing skills. So she can actually vent out her problems with her grandmother, and she can develop her interpersonal skills with her grandmother. And the grandmother can be also a medium of communication between her and her parents, because since she is wise, she can even help in allaying the anxieties of the parents, because they must be having their own stresses and they which they carry home. So she can be like a mediator between the two of them. So a strong emotional presence at home, it can be a platform for Ananya, and it also can also decrease her feelings of loneliness. So indirectly, she will stop using her gadget as much as she's using it now because of a strong emotional harbor. So I feel grandmother is a advantage of being at home.
Very well said, ma'am. Uh, we are nearly toward the end of our session. So last questions to both Niti ma'am and Amog ma'am. So Niti ma'am, one, everything is good with Ananya. She's a very motivated child, but because of this loneliness, she has developed this private, online friendship with some people. So how can we teach her that whether this escape kind of behavior and how she can avoid and understand what is good for her? Because this is a very slippery slope, and many times young adolescents land up in problems due to this. So what do you think, ma'am?
Yeah, so here Ananya needs to keep her emotions on one side for the time being and really start thinking critically. Whether my spending time online, so the person with whom I'm having a friendship online, whether that person is trustworthy, is that person's identity verified? Can I recognize the warning signs, whether that person is making personal requests or some secrecy, money, whatever? That this online friendship is actually taking away a lot of her time from the studies, and this in itself is causing stress. So, as Ananya is analyzing all these things, she needs to come to some decisions, and decisions she needs to take at two fronts. One is this online friendship which she is having, whether she should continue that, till what level she should keep it, what are the boundaries she should set it, and uh, always tell about the uncomfortable things to some trusted person. This is one decision she needs to take, and how much time restriction she needs to put on the online friendship. Coming to the second part is her getting connected to the social world from where she is getting herself out, and so she has started feeling lonely. So once she starts going to the dance class again, maybe the hobby class, she will again go and meet all those people who have been harnessing their similar hobbies what she is. She can at times even reconnect with the old school friends whom the last year 9, 10 standard friends, and she can actually get connected and spend a good amount of time and rebuild up that friendship. She can spend that time, as Amog has also said, with her grandmother, with her parents, and share a little bit of her stresses with them. And and whatever small time she gets, because need preparation, whatever she gets, she can even take part in the different community events like the colony ke sports hai, or volunteering in some small activities which are there. And in the similar way, she'll start meeting people, getting connected to them, and start talking to them. Will help in getting over her loneliness.
Loneliness is a new age disease, and very well said how she can cope up with. So last question to Amog ma'am. Ma'am, she's a very motivated child. Such children who are so focused on themselves are many times a delight, but their perfection is creating a problem. So what insight would you give to a person like Ananya so that she can use her strength to empower and not go in problems like at present she has?
Yeah,
What do you
since
think?
it's a mid-adolescent, so they already have a lot of decision making, critical thinking skills. We just have to empower them to use it and guide them well. So first of all, I think that we should start with making her. Sometimes the child is more calm than the parents, because the parents tend to overreact. So usually adolescents who have actually hot cognition now have to start showing cold cognition and calm the parents down, so that they can sit and have a healthy discussion and a healthy dialogue. So that is very important. So she can also teach them empathy and interpersonal skills. and you can use creative thinking, because sometimes in that hot moment we cannot express our grievances. So I always feel that jotting down the problem and putting it on the fridge so the parents can read it when they have cooled down, so that it initiates a healthy discussion later on. So that is one way of creatively handling the situation. And like how everybody's been suggesting, having relaxation techniques like, family time of hymn chanting or meditation, maybe even for 10 minutes a day, it goes a long way in relaxing both the parents and the child. And weekend family activities, which even Dr. Shailaja Mani ma'am has been talking about. So this creates healthy bonds and shows that all work and no play makes actually a dull life. So more than academics, is much more in life other than what you're scoring on the board. And one thing I would just like to add is basically parenting is about treating your child, with love and logic. You have to raise teens with both these qualities, teach them logical skills, critical thinking skills, problem solving, decision making, and with a little bit of love. Choose your battles, let it not be like a battlefield, and the child should feel seen, heard, and loved unconditionally, because they're going to always remember how they've been made to feel at home. That safety is very important, emotional safety.
Very well said, ma'am. So, as we say, love and structure are both required for adolescents. And probably in the case of Ananya, parents should focus more on love because she's already a motivated and structured individual. To wrap up, I would like to request our mentor, Swati Bhave ma'am, to sum up what she feels that we can do as adolescent health experts in a case like Ananya. Ma'am, please.
Again, Amok and Neeti, excellent job. You have covered all the micro details very well. So I'm not going to repeat. What I'm going to just say is ki if such a patient had come to me, my approach would be quite different than the approach I gave to the last patient. There I said that we already have red flag signs. I said they're working couple. And unless one of the parent takes a back seat and helps him at that point, this child can really go down a very difficult path. I would not say the same thing of Ananya. She has flag signs, but I would not say very hard red flag signs, because one, she has a tremendous support of the grandmother and the grandparents are around. So here I would caution the parents and give all whatever suggestion Amog and Niti have given, and then say only if this does not work out, then one of you may need the help. But here I think with the grandparents' help and whatever suggestions are given, this child can be managed for at least a few months, and I think she'll come back on track. And this is not going to be a very serious issue as compared to the first one. The first one, there are red flag signs. And if this is not taken as an emergency, that child, because I'm handling so many cases now in my family guidance center, and the parents who have not accepted that just now the child should be a priority and I should take a backseat from my career and help the child has really gone down in a very bad way. So here, this is the difference I would say, that where the parents should step in, where the parents should sacrifice their career, where the parents need not take such drastic steps, and when there is parental support available in the form of grandparents and the flag signs are not very serious, one can manage this child without going into drastic steps. Thank you.
So, all the delegates who have attended the session, we had a wonderful talk from all the four panelists, Yali ma'am, Shailaja ma'am, Amog ma'am, Niti ma'am, and most of all, Swati Bhave ma'am gave us the concise how clinical response from her vast experience. The chat was continuous buzzing with messages, and I'm thankful for all of you for getting involved. Any few questions, if are there for the panel, one or two questions we can take. This type of sessions we'll be conducting every 2 weeks on Fridays, same timing. And if there are no questions, I'll request Samir Shah sir to announce and then we can wrap up. Samir sir, you're there?
Yes.
Yes.
Yes, sir. So it's a really excellent eye-opening and one of the session which what we're looking for as a opening session of the our webinar series of that panel discussion. And this was really such a case that what we usually getting on day-to-day practice in our own clinic, but we are not much focusing on that to how to implement that life skill, and we are just giving the some advice and sending them back, because these are the window of opportunity for the us being a pediatrician to work together with the parents and adolescents and give them a right pathway about the how to implement this, what are their strengths, what are their weakness, what will be the outcome if they do proper life skill education implementation. And for that, this series is going regularly now, as Dr. Sandeep has said, and we proudly announce that we are also going to celebrate our whole week of the adolescent health, Aki week celebration. That was every yearly now we are celebrating. On this year again, it is between the 17th to 24th July. And our again theme will be the same as the preventive prescription of the life skill approach. And for that, I am requesting all the people who are attending give a collaborative invite for some type of the activity about the life skill education to your own area, and that will be what we are learn such type of the discussion with the expert. We will get more and more insightful about the implementation in our day-to-day life. And we also happy to announce that with the collaboration of the Adolescent Health Academy of the IAP, AHA, we are going to conduct during the our week celebration about the orientation to life skill 5 online session, online certified course between the 20th of the July to 29th July, with a concessional rate considering the our Aki week celebration, and very nominal fees will be charged. Very more detail we will going to provide in the our group. So this is the thing that what we are concluding today. Next session will be on the 17th of the July, our first day of the Aki week celebration, with more such cases with the expert will lead our master training course, and they are know about the insight what we actually want about the life skills. Over to Swati ma'am, concluding.
Yeah, so I'm really happy that we are going to collaborate with AHA, and Piali is the president-elect here, and so it will be really a wonderful program. And we are doing it every first and the third Friday, and Samir will be regularly putting up the links. There were people who are asking how will we get the updates, etc. So in the volunteer group and the Aki official broadcast group, regularly Samir will be putting up details of each session and Zoom link and everything else. Any other questions?
Good evening, ma'am. Ma'am, Dr. Subodh Gupta, can this webinar be revisited?
Yeah, I just wrote out that the recorded session will be put on the akitrainingprograms.com. And if you go to our website, you will see recorded webinar link. And this will be put periodically. So not only this, you can see all Aki recorded programs on that link.
Thank you, ma'am.
Madam, one question.
Appreciate
Ma'am.
this.
Yes. Can I ask a question?
Yes.
Yes, madam. One question is there was a 11-year female child who is having a good
See,
severe
one
stress.
case discussion we won't be able to do now because we already have this. I'll put this Aki email because in Aki, one thing we remember, we are very strict about time. So we do not want to exceed time anytime. And if you have any individual case discussion, please send an email here.
And if you send the email about your case, we will definitely take that case into the our upcoming webinar also, if it is really relevant to our topic.
Thank you.
Can I ask a question, Swati ma'am?
Yeah.
Yes, please.
Do we need to give some prescription sort of after a life skill session with the child and the parent?
It is always better because, like, if, for example, at least if you give tips, like we are helping to coping with emotions and we are giving a 6-second pause, etc., etc., because the patient requires a recall. No? If you just say everything and just send him away, like even exercise, I give what is known as exercise audit or exercise prescription. So giving some notes is always better so they can follow it.
Okay, thank you.
It is called doctor's journaling.
True.
So no more questions? Everything
So
Samir is regularly putting up. We have a Aki broadcast group. We have a Aki volunteer group. And if you go to our website, you'll get regular pop-ups also. So everything will be there. So there's no worry about whether you'll be getting information about the next program or not.
Ma'am, just a last thank you to my moderator, Dr. Sandeep Kaude. He has been a hard task master, in fact. And
याली तू सबको गाली क्यों दे रही है हमारे ग्रुप को?
गाली नहीं दे रही मैम, बहुत अप्रिशिएट कर रही हूँ. अगर उन्होंने पढ़ाया नहीं होता तो हम पढ़ते नहीं.
Thank you, Sandeep.
Thank you so much, Sandeep.
Thank you, ma'am. Thank you.
Thank you, Piali. It was Piali, Shailaja, Amog, Niti, excellent. Sandeep, excellent moderator. And always usual meticulous Samir with organization, with all the meticulous details. All of you have worked very hard for the program. And I'm very happy to see the input from all the participants also.
Thank you, ma'am.
Thank you,
so
ma'am.
much, ma'am.
Good night
So,
again. Good night,
night.
everybody.
meeting on the 17th
Night
of
all.
the July
Good
again.
night.
Thank you.
Yeah.
Good night.
Yes.
17 July next.
Bye.
Bye.